Thank you so much, everyone, for hopping on today. I hope everyone had a great Thanksgiving, and depending on where you are in the country, that you are not still snow shoveling, I suppose. Um, Thank you for joining us for our winter legislative briefing on policy to plate, food and children's health. My name is Liam Cicino, and I'm the public health advocate with US PIRG, where I lead our food system reform work to reduce the intake of ultra-processed foods and end the overuse of antibiotics in animal agriculture, among some of our other campaigns. PIRG is an advocate for consumers and public health, working nationally in over 20 states to advance legislation that makes our products safer, business practices fairer, and the food we eat more nutritious. I'm also joined by Scott Faber from Environmental Working Group and Travis McCormick from Make Texans Healthy Again. A couple of housekeeping things before we get started. While we keep participants muted for the duration of our call in order to maintain sound quality for all of our attendees, you should have a Q&A option on the bottom of your screen where you can send questions to us at any time during our discussion that we will get to at the end. There's also a chat function that you could put questions there. If you need help hearing or need closed captioning, there should also be a button at the bottom for that feature. Um, we will try to answer all of the questions we receive, but if time doesn't permit it or we need to go get more information, we'll be following up with folks individually about their questions. So we're thrilled to have people from all over the country join us today for a vital discussion that's becoming a top political priority for families and parents across the country, the health of our children, and in particular, the food they eat. The reality is stark that we have a dramatic and concerning increase in diet-related chronic diseases and other developmental issues among our youth. Currently, we're witnessing rising rates of obesity with about 14 million or 24% of our kids qualifying as obese. Type 2 diabetes cases in children have risen 62% since the COVID-19 pandemic. An estimated 1 in 7 kids have or are at higher risk for hypertension, a risk factor for cardiac disease or stroke, and about 1 in 10 children now have an ADHD diagnosis. While there's many causes for these issues beyond food, including screen time and social media, environmental pollution, and increasingly sedentary lifestyles, the food we put on our plates has a tremendous impact on health outcomes for young children, and that habits that children develop early in life follow into adulthood, making the need to model healthy eating early and often a key priority. Luckily, there's big momentum for change. Around the country, forward-thinking advocates and legislators are recognizing the urgency of this situation and are actively introducing bills designed to improve the health of our nation by improving the quality of the food we consume, especially the food that fuels our children. To share their invaluable experience and successful strategies, as I said, we're joined by two organizations that have been on the front lines of this movement in their respective states. So Travis McCormick from Make Texans Healthy Again will be sharing about their work, particularly passing SB 25. And Scott will be telling us a bit about the bill in California that was passed on ultra-processed foods, AB 1264. Without further ado, I'm going to mute myself. I'm going to pass things over to Travis.
Hey everyone, how are y'all doing? Excited to be here and kind of share what we were able to do in Texas. Just by a little point of background, I launched Make Texans Healthy Again almost exactly a year ago, with a month before Texas's legislative session. Um, just because I work kind of in and around politics up at the Capitol as my day job, and just saw that we were having this moment in time with this country where both sides of the aisle were really unified that there is a emergency when it comes to the health of our families and children. And I really didn't want to miss out on this once in a generation opportunity to really reform our nutrition and healthcare system. So quickly got to work. just reaching out to legislators, analyzing bills, compiling a legislative agenda, building up volunteers. We hosted our first advocacy day in February of this year. Ended up having close to 30 volunteers hitting the halls, just with some literature on chronic disease and ultra processed foods, and just the importance of kind of moving the needle on this stuff. It was amazing. We were able to get a Make America Healthy Again caucus put in place at the Texas Capitol. It currently has over 30 members. It's bipartisan, it's multi-cameral, so we have both House members and Senate members involved. And by the end of session, we were able to pass 25 bills, which for any organization is a pretty good accomplishment. But for a volunteer group right out the gate with less than a month before session, I'm very very happy with what we were able to do. We supported a wide range of things, especially in relation to the food issue. But a couple of the bills that I think we're going to focus on today are Senate Bill 25, which requires warning labels for packaged foods that contain any of 44 additives listed in the bill. So the whole idea behind this is that the warning label must be pretty egregious. It states, warning, this product contains an ingredient that's not recommended for human consumption. The idea being that no company is going to allow the stigma of that on their product, and they're going to go back and reformulate. That bill obviously faced an uphill battle towards the end. But what was really unique about that fight was just how many green lights we got at the beginning, and I think that's really a testament to how politically popular these issues are, and how much of an opportunity y'all have in your states to kind of make similar strides. First off, it was Senate Bill 25. In Texas, the lieutenant governor and the speaker get to designate low number bills as priorities. So if you're in the top 25 bills, you're kind of considered almost an emergency item, meaning you have the blessing of either the lieutenant governor or the speaker to make this bill policy. We lucked out. We were granted dual Senate Bill 25 and House Bill 25. So that meant that the lieutenant governor and the speaker were united that this is a priority and it's something that needs to be done quick. So we had that working for us. The Senate, as soon as it was filed, they had a hearing just a few days later. Senator Lois Kolkhorst authored the bill, and she passed it out of her committee within 24 hours, and it was on the Senate floor the next week. Flew through the Senate 31-0, and we got over to the House, had a hearing, things were moving, and then it just halted and was kind of being held up behind the scenes in the calendars process for probably 6 weeks. I mean, I think we passed this out of the House 1 week till the deadline to get it out. And throughout this time, we didn't hear a peep from the processed food companies. It was basically me and Chronic Disease and a couple of other organizations really kind of going around educating people, promoting this bill throughout the Capitol. The day before the bill hits the House floor, all of a sudden, every processed food company, every grocery store, every soda company just showed up to the various offices throughout the House with a one pager about how this was going to be the end of the world, all hitting it from different angles. They even had the Farm Bureau and a lot of the ag folks coming out against it, which was insanity to me because this kind of helps people eat whole foods. But fortunately, we had been doing the groundwork and we had a lot of allies in these offices. So as soon as these flyers started hitting, I just had dozens of staff members just texting me pictures of them. So I was able to kind of compile all of the claims that were made, spend some time refuting them. And within a few hours, I had an army of 6 volunteers up at the Capitol, and we hit every single office with our reputation of all of these things. And we're able to get good talking points to the author of the bill so she could have conversations with her colleagues, emailed all of the personal emails, text messaged all the personal cell phone numbers that we had for all these members, letting them know that it was important to just follow through and get this bill passed. And we ended up, it wasn't unanimous like it was in the Senate, but we ended up passing it pretty handily out of the House. The governor signed it. We ended up having a bill signing ceremony a couple of months ago with a lot of kind of the national folks coming by. Another bill that we kind of ran in tandem with that one was Senate Bill 314. And that essentially banned all harmful additives and artificial dyes from school lunches, which I think is just going to have a tremendous impact on students and their ability to learn and nourish their bodies. Now, it doesn't guarantee that the foods that are being served are going to be healthy. You know, these are going to be the same consumer packaged foods that they're eating, but they're going to be reformulated into more like what kids are eating in Europe and Canada and Australia and places like that. So it's a great first step. But just really excited by the momentum that those ones got. That one passed almost unanimously out of both chambers as well. We just kind of supported a lot of I won't go through all of them, but we also looked to kind of support some things that just made it easier for people to get access to quality food, like reducing regulations and cottage food industry, so that people making kind of local, homemade, minimum ingredient foods could get access to their products better to people. Um, same for food as medicine. We were able to pass House Bill 26, which allows you essentially to use Medicaid to get nutrition counseling. And originally in the bill, we put it to where they could purchase food. That got stripped out, unfortunately. But it's a good first step. It's cost neutral too, so I mean, there's really no arguments against it. But we'll come back and fight next session to try and get the food piece added in there. Other than that, happy to talk about any kind of our other wins, or can pass it along.
Thanks so much, Travis. And I'm going to hand it over to Scott in 1 second, but reminder that if you have questions about anything that is said, you don't have to wait till the end. You can put those in, and we will get to those at the further end of this webinar. But I am going to pass it off to Scott to talk about California.
Yeah, well, thanks, Liam, and what a great success story, Travis. Like it's amazing progress to be made in 1 year, and really a testament to just how much excitement there is right now to help people build healthier diets. Again, I'm Scott Faber. I'm with EWG, and I also teach food law at Georgetown Law School. I in 2025 worked on similar bills in 5 states, including West Virginia, Virginia, Utah, Pennsylvania, and of course California. And so I'm going to talk a little bit about California. I'm going to throw our AB 1264 Resource Center. Hopefully, people can see that in the chat. If you want to read the bill or see our talking points and all the other materials we developed in support of AB 1264. As some of you may know, AB 1264 is the first ever bill to define ultra processed foods, and directs California state regulators to phase the worst of the worst UPFs out of California schools by 2032. There are a lot of academic definitions for UPFs. And so when you read, as many of you probably have, the Lancet studies and other things that have come out recently about UPFs, they're using different academic definitions that experts and social scientists and nutritionists use. What was lacking was a regulatory definition that regulators could use to say this food is a UPF, and that ultimately formulators, food companies could use to begin to move away from foods that were UPFs. And so how AB 1264 defined UPF, and the fact that it did define UPFs, was the big win. It's the first definition anywhere outside of 2 cities in Brazil, anywhere in the world, that is a legal statutory definition. Very simple. For a UPF to be a UPF in California, it has to be high in added sugars or sodium or saturated fat and have one of many cosmetic additives. So things like flavors, colors, emulsifiers, gums, thickening agents, that those are all spelled out in the bill because they're linked back to parts of the Federal Code of Federal Regulations that define which substances fall into which of those categories. The author of the bill, Assemblymember Jesse Gabriel, and his co-authors, who included the Republican leader of the Assembly, James Gallagher, worked really closely with a lot of different interest groups, including folks in agriculture, to clearly exempt from that definition things like raw agricultural products or minimally processed foods or pasteurized milk, for example, because they wanted to be sure that the definition, the legal definition of UPF, didn't sweep in foods that were obviously not ultra processed foods. The reason they focused on UPS, probably obvious, but I'll just mention quickly, is that these foods are really very different from processed or minimally processed foods, not just because they're high in saturated fat or added sugars or salt, or just because they have one of these cosmetic additives, flavors, colors, emulsifiers. It's because these are foods that have been engineered not just to be delicious, but to literally be irresistible. And they are engineered in ways that interfere with the signals that are sent to your brain that tell you that this is highly rewarding. And so eat more of it, or you're full, stop eating. And so there's some fascinating scientists really being led by folks like Professor Ashley Gearhart at the University of Michigan that shows that these foods have all the same addictive qualities as other things that we might think of as addictive. So these are the fact that they're call foods might be something to reconsider because they are more like irresistible food-like substances. Our ancestors would certainly not recognize them as foods, put it that way. So now the next step, of course, with any laws is implementation. California's Department of Public Health is leading that effort, but they'll be working with other California regulators again to start with that list of foods that are high in added sugars or sodium or saturated fats and have one of these cosmetic additives. Start with that list of foods and then figure out which of those are of concern. And then those foods will ultimately have to be phased out of California schools by 2032. It's a really great time to get involved in that process because between now and 2028, California state regulators will be trying to figure out which of those foods are of concern and therefore should no be longer be offered in schools. And it's an exciting time to be working on those issues. Just a quick thing I just wanted to mention to build on something Travis noted, which is a number of states, Texas, of course, Arizona, but also West Virginia, Virginia, Utah, many others have phased out colors, synthetic colors from school foods. And while I think we're always hopeful that USDA and in collaboration with FDA will just choose to change the federal rules that govern what can be sold at schools, I don't think we should wait for that. That rulemaking process can take a really long time. So if you're thinking about things in your own states to take on in 2026, simply getting the worst of the worst chemicals out of school foods is a good place to start. There are other ingredients of concern, some of which are in text in SB 25, some of which are not. These are foods that, I'm sorry, additives and substances that have been banned elsewhere or are on retailer lists of ingredients that they don't use in their own store brands and for which there's really strong evidence of health harms. Those are additives and substances that just obviously shouldn't be in our school foods, probably shouldn't be in our foods generally. But again, there may be opportunities in 2026 to build on what states like Texas and California, West Virginia, of course, with their bill, HB 2354, what they've done. So if you're interested in that list, I'll put my email in the chat. Happy to talk about which additional ingredients should go. Again, ingredients that already banned in the EU or showing up on retailer lists of ingredients they won't use in their own store brands. And of course, there's strong evidence of harm. So I think that's kind of the secret sauce that we've seen that's been successful in states like West Virginia and California. And frankly, none of our friends in industry seem to think they make much sense, especially when there's evidence of harm that they are allowed to use these ingredients. A lot of them will tell you, I think they probably without hesitation, that we need to raise the floor so that all of these companies, as Travis and I were talking about before we hopped on together, we need to raise the floor so all of these companies are kind of quickly reformulating away from the ingredients they've already stopped using in other parts of the world. So why don't I throw it back to Liam and Travis and love to take your questions.
Yeah, thank you so much, Scott. It's yeah, amazing to see states like Texas and California really taking the leadership to make the foods our children eat, ones that are more nutritious, whole, and containing less additives broadly. It represents momentum as well that we'd love to see replicated in other states. At PERG, we're really excited by legislative efforts to reduce the presence of ultra-processed foods in school meals. We see laws like this currently being considered in states like Pennsylvania, Michigan, and North Carolina. We're ready to support elected officials wanting to do the same in other states. At PERG, particularly, we're also pushing for corporations, similar to what Scott was saying, just to remove kind of the worst of the worst. And that's why we're pushing corporations like Sodexo, which is one of the largest suppliers of school foods in the country, to voluntarily remove synthetic dyes from school meals before the next coming school year. Um, with that being said, I want to jump to some questions we have. Um, let's see. Someone asked, was there any significant opposition to getting bills like these passed? If so, who is the strongest opposition? And, maybe if you have any advice for working around that, I could start with Travis.
Yeah, so I mean, the school lunches bill was kind of a slam dunk. I remember I was in a hearing testifying on this, and the guy next to me testifying on behalf of a coalition of processed food companies. He, yeah, I would. My testimony was really short. Actually, I had to go to another hearing to testify, but I had to sit there for 45 minutes while they berated him from the dais, and I actually missed testifying on the next bill. Um, so, I mean, on the school lunch piece, like, targeting these vulnerable populations that people just in their day-to-day life know deserve a higher quality of care, is the easiest low-hanging fruit. So, starting with schools, hospitals, nursing homes, things like that, to put in these requirements, it'll eventually bleed out into the culture at large. So, I really do think that's probably strategically the best way to start. Um, I mean, other opposition. I mean, it was really just fourth quarter scare tactics, from the massive corporations. I mean, and most of them wouldn't even put their name on it. They'd operate under some sort of uh, organization that you'd never heard of until 48 hours before these things came out. None of them testified publicly except for that one coalition I mentioned. Um, and they didn't bring any of their high brass. They just sent this guy who I felt terrible for, honestly. He was just a hired gun. But they're like, where are the CEOs? He's like, oh, well, they're going to come tomorrow to have one-on-one meetings with y'all. Well, what they were trying to do was not be on the record coming across against something as common sense as cleaning up school lunches.
Right.
So, I mean, that's where you're going to have opposition.
Yeah, I'll just say initially there was opposition from farm groups, but many of those groups not only either changed their position to neutral, some of them even supported the our bill to define and phase the worst UPS out of California schools. In part because of the changes that were made to make clear that raw agricultural products or minimally processed foods, think of like nuts that might have been seasoned or something, would not be defined as UPFs. But also because I think many realize that pushing some of the UPFs off the plate created more room for fresh, local, California grown produce. And so it was a win-win from that perspective. But like Travis, we had the same experience in California where, despite providing hundreds of changes to the bill, many of which were suggested by the processed foods industry, there was really no version of the bill that the processed foods industry was going to be able to support. And I think at the end of the day, legislators realized that they were not looking to get to a compromise, which ultimately worked against them. I do remember at one point, not on this bill, but on a similar, not on AB 1264, but on California's bill to ban colors from school foods was passed in 2024, where Democrats on one side of the Senate panel were all kind of wringing their hands and saying, "Gosh, really ought to be FDA's job to do this." And but of course, FDA has an unbroken 67-year record of failing to protect us when it comes to these kinds of additives and substances. And but they were really kind of tortured about this question about why, wouldn't it be better ultimately if FDA did the job Congress gave FDA in 1958? And at the other end of the dais, the Republican members were like, so wait, so this stuff is bad for kids? Why is it in our food? And so it was one of those moments where everyone sort of got to the same result, but in different directions. And I think the thing that was also very important to understand is still sadly true, is that FDA is not coming to the rescue. They have fewer people. Even though the leadership has pledged to do things, and we're always hopeful that they'll deliver on those pledges. So far, nothing's changed in terms of which ingredients are allowed in food, whether how new food chemicals are brought into commerce. Until things do change, and again, we hope that they do. It's really the states are our only protection, and so. And even if FDA were to change the rules to make it harder to bring a novel chemical that's unknown to commerce to commerce through the so-called grass loophole, and even if FDA were to say, okay, we're going to start to methodically review the thousands and thousands of substance additives and substances we're already eating, that process will take an extraordinarily long time. And again, there are fewer people today at working on these issues than any time in the last 25 years. So I just again don't I know the industry will at some point as you're working on your bills in 2026 say, well, look, everything's changed now. FDA is going to do a better job. Well, so far that's not been the case. It could certainly change, but that's not been the case so far.
Thanks. I have a question for Scott saying, how are you going to build on this momentum, I suppose, given that, you've passed both of these laws around food and school foods. What do you think is next for Make Texans Healthy Again?
Yeah, well, gosh, Travis, that's a much better question for Travis. I'm again happy to share. We've gone. One of the things we'll be releasing in the next few weeks is the first ever uh, cast number by cast number analysis of all the additives and substances that we can eat that are not allowed in food in the EU. And you've all heard these big numbers before. No one's actually gone through all the different databases and figured out precisely how many additives and substances are allowed in our food that can't be eaten in Europe. And in particular, we've gone through that list and then identified, as I mentioned earlier, those additives that are of real concern because there's strong evidence of health harms and have also been many of them are already on the list that retailers use to say what can't be in their own store brands. So you think Walmart, HEB, Albertsons, they all have lists of additives they don't put in their store brands, their private label brands, but the famous name brands still sell to us, even though they can't use them in other countries. So happy to help folks in Texas or any other state kind of look at that list. And I totally agree with Travis. Schools are special places, and we shouldn't. But that's certainly the first place to think about when we think about protecting consumers is protecting kids who won't have labels to read or parents to sort of point them in a different direction.
Yeah.
Yeah, I always say, a parent shouldn't have to read 5 books to go grocery shopping. Like what we're trying to do here is, create a situation where just, your single moms of the world can navigate this because everybody's trying. It's just, the deck's stacked against us.
So true. Yeah, I don't understand the notion that goes back to the 90s that if we just put it on the package, consumers can kind of decide for themselves just seems so out of date in 2025, right? Where I think everyone, regardless of what else, where we might stand elsewhere on issues of the day, we all expect the food we buy to be safe, and we shouldn't be expected to sort of navigate the ingredient lines to decide, oh, okay, this ingredient is banned in this country and that ingredient's banned in another country, and if it's on the shelf, it should be safe. And the idea that we should all be wandering around the grocery store with our reading glasses on doesn't make a ton of sense in 2025.
Yeah, that's there's a good app called Yucko that we sometimes plug.
Yuka, yeah, we've got
Yeah,
one. We have it's on the EWG does the same thing on our Healthy Living app, but there are a lot of great apps like Yuka and EWG app, Food Scores app, are
but
great for kind of just figuring out which ingredient, which foods to avoid, not just because they have these questionable ingredients, but because they're also are high in fat, sugar, and salt.
yeah, but definitely agree in principle. It'd be great if we could go grocery shopping without having to scan everything before you throw it in the cart, right? Um, Another question we had was, what opportunities have either of you had to collaborate with advocates in other states to build on the momentum from these bills?
Yeah, well, Texas, Travis, have you worked outside Texas? Do you want to say more about
I
that?
have not. I've had a few people reach out, wanting to kind of duplicate what we've done, but none of them have really kind of followed through. I have, so I got connected a couple of months ago with the Maha Institute, and they're kind of trying to build out state presences across the nation. And we had their director of states in town. We've been kind of doing some various summits with I mean, experts and leaders and influencers and all sorts of people, just trying to figure out what our legislative agenda is going to be for about a year from now. And she ended up coming down for that, and just kind of, I think they're actively trying to build every state should act autonomously. We are the experiment grounds for the country. And I think anything we pass, anything the federal government should do should be a floor, not the ceiling. I think there are efforts happening in other states. I just don't know that they have fully been organized and fleshed out yet.
Yeah. I'll just throw in the chat. Hopefully folks can see this. We have a tracker on our website of that is usually up to date that shows all the bills that have been introduced around the country. We'll try to keep that up to date for in 2026 as well. But there's just so much excitement right now because for so many reasons, I think legislators, leaders in Washington have all discovered what my law students at Georgetown know, which is that no one is really checking to make sure these substances and additives are safe. I think a lot of folks really just assumed if it was on the shelf, it was safe. And now you all know, maybe you're here because you knew this, that that's just not the case. And so while that's been the case for 67 years, it's finally getting some attention, and that's great news. A few states have really have broken through. We talked about California and Texas. Of course, West Virginia has the strongest law in the country, arguably, because they affirmatively banned 9 ingredients when they passed their law, 7 synthetic colors, BHA and propylparaben. Utah and Virginia have banned colors from school foods. Arizona has also banned ingredients from school foods, colors, and other ingredients. Um, I think other states are likely to break through in 2026 as well, because there's been so much progress made in places like Texas, Louisiana, Arizona, and elsewhere. I think there's also a lot of interest in uh, tackling pesticides as well. I'm sure some of the folks I see Zen is on the call, and Zen knows 1,000 times more than I do about pesticide regulation. But there was a recent study that was done by the Center for Biological Diversity showing there are 85 chemicals, pesticides that are banned in the EU that are still permitted in the US. They make up about a quarter of the by volume of the pesticides that are used in the US. And so I think there's growing interest in building on some of the earlier efforts to ban pesticides in the US. Also, probably many folks on this call know, just like there's no preemption, there's no a federal law that blocks states from banning food chemicals or restricting food chemicals. There's also no preemption of state and local pesticide laws. And so many states, including Texas, have passed laws to go beyond what the federal government has done with regards to pesticides, in particular, again, to Travis's point, to restrict how pesticides are used near schools. I'm doing this from memory, but I believe Texas has a law that requires a buffer for pesticide spraying around schools for certain kinds of pesticides. I will double check that and send it to Liam if I got it wrong. But so there's more and more interest in tackling pesticides, especially pesticide use around schools. The last thing I'll just mention is all of these state laws are in jeopardy because there are folks in Washington on behalf of industry who are fighting to change federal law to block or preempt states from doing what we've been talking about on this call. And so, if you're interested in getting involved in that fight to preserve state powers to be, as Travis said, laboratories of democracy, please reach out to us. We are help run every other Wednesday meeting of folks who just want to make sure that states can continue to protect people while we're all hoping the federal government does the job Congress asked them to do many, many decades ago. So, but that all this great work could be lost if we're unsuccessful in our efforts to preserve state powers.
Yes, I mean, that's a great point. I think, from a pesticide perspective here in Texas, our number one priority next session is going to be to oppose any sort of manufacturer liability shield like what passed in Georgia. I guarantee you something like that is going to be floated. And we had a kind of a litmus test vote on that this last session. During the Senate Bill 25 debate, there was actually a piece of that in committee that added to the additives list. It had glyphosate and atrazine in it, which, from a practical standpoint, it's not an additive. It probably wouldn't have counted if a crop had been sprayed with that and then that crop was used to build something because it's not being added in. But it got stripped out of the bill, and it got stripped out of the bill very handedly. And I think, it just really goes to show that, I thought the most kind of controversial piece on the MAHA agenda was the vaccine stuff. It's not. It's definitely the pesticide piece, and that's what's going to require the most education on. That's where I'm, spending a lot of time talking to folks, and I'm trying to be, pragmatic and realist on it. But like, I mean, I've got a member of our coalition who's a pollster for a living. A lot of our group's entirely volunteer, so we just kind of piecemeal the stuff. And he added a question onto a poll he was doing statewide in Texas to Republican primary voters just a month ago, and 77.5% of Republicans said they were more likely to vote for Republican candidates that favored phasing out or reducing pesticides in agriculture. So the one thing we're looking at, and it'll really largely depend on the traction of the liability shields and how much bandwidth we have to push there. But I would like to see a phase out of pre-harvest spraying this next session. And I think it's a really stretch goal, but I think it's something we have to start discussing so that we can get it here in the next few years. So that's going to be kind of our push on that front.
That's I'm so glad to hear that. We 6 years ago asked the EPA to ban pre-harvest use of glyphosate as a desiccant, and we are still waiting for a response. So it's great. It's a great example of why states need to take the lead. We can't wait for EPA to do the right thing.
Yeah. I see we have one other question here around if there's any bills that anyone's working on or are aware of in Virginia this session. I will say I know that I think Scott, you mentioned it, a similar law around UPFs and school meals was signed by Governor Youngkin earlier this year. I'm not sure of any other ones in the session that we're currently focused on, but I will be sending some resources and contact information after this. And PERG, EWG, I'm sure Travis would be happy to speak with anyone about any potential food laws in Virginia that we could work on together. But
Just
Scott, I'm sure if
waiting
you
to hear from our allies in Virginia who worked with oh gosh, I'm blanking on her name, legislators there who did ban dyes from school foods in 2025. And so, as Travis said, they're your states. So, if you'd like our help, we're happy to provide it. And if you'd like us to steer clear of your states, we're happy to do that too. So just let us know what's best.
Great. Well, thank you so much, Travis and Scott, for joining me here today for this conversation. For all of our participants, we'll be sending along contact information for all of us in our organizations after this call, as well as the model bills of some of the bills we discussed, trackers that Scott has provided, as well as some more information about PERG's ongoing campaigns as well for food system reform. But thank you so much, everyone, for joining us today, and I hope you have a great rest of your holiday season.
Yeah.
Thank you, Perg. Nice to meet you, Travis.
Nice meeting y'all.